Welcome back. February is American Heart Month, and today is National Wear Red Day. People everywhere wearing red to bring awareness to the serious problem of heart disease. Joining us now to chat a little bit about that, Dr. Scott Johnson, who's a cardiothoracic surgeon with Aurora. So, Dr. Johnson, you got a lot of red going on here, and I noticed the
Yes,
red
sir.
pin, too. What's the significance of that?
So the red pin is actually a red dress, and it's to bring awareness specifically to women when it comes to cardiovascular disease.
So when we talk about things that cause women to die across the U.S. and across the world, is heart disease the biggest one?
It is. So heart disease is the leading cause of death for men, women, and pretty much every ethnic and race group in America.
How much of it is your genetics, and how much of it is things that you can take precautions? I know we hear so much about exercise and about diet.
Sure, that's a great question. So it's hard to say what component is more important than the other. They all really add together to really affect your risk. Genetics is certainly important, so if you have a family history, it's important to talk to your family practice doctor or anybody that's taking care of your health. But there's definitely modifiable factors that we need to pay attention to lower our risk for cardiovascular disease.
At a time when we might see some snow this weekend, you were mentioning heart attacks and shoveling.
Definitely.
Is that a big risk factor for someone who's not really in shape?
It is. So if you have heart disease that you might not know about, any sort of exertion or activity can bring out chest pain, jaw pain, things like that. And so shoveling's a big exertion of energy that can cause you to have chest pain. And it's important to know that if you have risk factors such as a family history that we talked about, high cholesterol, diabetes, high blood pressure, and you start to experience things like chest pain or jaw pain, you really need to get to the emergency department as quickly as possible.
Any way you can do kind of a brief self-assessment before you, even if you don't go see a doctor?
Yeah, definitely. So at Advocate Aurora, we're very far along in our treatment of cardiovascular disease. At our website at aurora.org, we have a health calculator where you can put in things like your age and other medical comorbidities you might have, and it will give you a good risk assessment of your cardiovascular disease.
All right, Dr. Johnson, thank you so much for coming in this afternoon. We really appreciate it. Of
Definitely.
course, you can find more information on this interview and on Wear Red Day at our website, tmj4.com. Just head to the links